internal carotid comes in,
Sorry.
come on, guy, right there.
What is that one?
That's the internal carotid.
Okay, and the basilar is in the
Remember the
back.
carotid canal? Internal carotid, right there. The other vessels that supply blood, vertebrals back there, or vertebrals, as some people say. Now let's see where they come from, because you'll be asked these too in the neck. Unfortunately, there's nothing over here, but we have the common carotid, the internal carotid, common, internal, right there, which came in through there. Forget that little vessel there, but this one right here, coming deep up through the vertebral canal, the transverse foramina of the cervical vertebrae here would be the vertebral artery. So it goes in
And then this one's the occipital end, right?
occipital artery, facial artery, and superficial temporal artery. In case you're wondering, there is a deep temporal too inside, but they're, deeper in. But there's occipital, facial, which is broken off, but it's the one here, and then the superficial temporal. By the way, there's a superficial temporal pulse. If you put your fingers in front of your ear, you can feel it. And if you have a good strong pulse, you can feel your facial pulse too.
Is that why you twitches sometimes? Like in your
Twitch?
Well, no,
I
like
think
you
those
can.
are probably muscles.
Oh, okay.
No, I wouldn't think that would be the pulse you're feeling. But inside, we have anastomosis between the vertebrals indirectly and the internal carotids. If you follow the vertebrals inside, and I know this is very difficult for everybody to see, it's almost impossible. If you follow the two vertebrals up, they will join along the front of the brainstem there to form the basilar, that's how you say that, the basilar artery. If they're a single one. It'll come up and give rise to the posterior cerebrals here. They go to the back of the brain,
Makes sense.
okay? Then you'll see connecting the posterior cerebral to the middle cerebral here, middle cerebral and
Is that little
carotid.
one?
Those would be the posterior communicating arteries.
Those little, just
Those
those
little
little?
ones there, see them?
Yeah?
I think the other model has them bigger, but and my picture I know really has them big. But those would be the posterior communicating. Then coming off of this middle, this is the middle cerebral, which goes out to the middle part. This vessel will actually go along the lateral cerebral sulcus, supplying the temporal lobe and the parietal above,
Okay, that makes
and
sense.
so on. It's a pretty good sized vessel. Then it gives off two small branches that go forward, anterior cerebral arteries.
Okay.
They're going to supply frontal lobes. Now look what connects the two anterior cerebrals.
Communicating.
Anterior communicating.
So basically, the communicating
So
ones are
that
the
forms a
smaller ones.
complete circle, an anastomosing circle of vessels, which are commonly called
Willis.
circle of Willis.
So
that's
basically,
what
the
you see
smaller
there.
ones are the
Now,
communicating.
question, yeah, communicating here and communicating there.
Obviously, they connect.
Does anybody know what gland sits right there?
Is that the?
Pituitary
yeah,
gland,
pituitary.
exactly, and this surrounds it. Interesting point too. I watched a program one time, one of these medic